Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Every 40 seconds, someone in the U.S. has a stroke, and most people don't see it coming. A drooping face, slurred words, sudden confusion. Would you recognize the signs? And even if you did, would you know what to do in those critical first minutes? Well, today we have Dr. Firas Bounni, a neurologist with Baptist Health Brain and Spine Care. And he's here to share his knowledge with us about strokes, as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Miranda Kahn, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. And let's kick things off now with a question from Anderson, who reached out to us through our website, allhealthtv.com. So Anderson's question is, Dr. Bounni, my stepmother, who lives across the country, was hospitalized last week and diagnosed with a stroke. She's not very old, just 55. They say they got to her in time and she should make a full recovery, but I'm still not sure what exactly happens when someone has a stroke. Can you help me better understand this? Dr. Bounni, this is a really good question. What exactly does happen when someone has a stroke?
Well, thank you for having me. And absolutely, this is an excellent question. And I'm very glad, Anderson, that she made it to the hospital on time, because a lot of people don't make it on time after having a stroke to the hospital. So what happens is it depends on the type of stroke that's going on. There are two types of stroke. One we call ischemic stroke, and the other we call hemorrhagic stroke. In ischemic stroke, what happens is one of the arteries of the brain gets clogged up. For example, by a clot that comes, let's say, from the heart that goes up to the brain and just kind of causes an occlusion in one of these vessels. Sometimes it happens in the smaller, tiny arteries of the brain too, so it doesn't have to be a big artery. And that's a problem for the brain, because brain cells are accustomed to having a constant flow of oxygen and nutrients that go through these arteries. And if that gets interrupted, some of these brain cells start to die. And that's when you have symptoms that we will talk about later. In hemorrhagic strokes, what happens most commonly is the tiny arteries in the brain, they burst, especially in people with longstanding high blood pressure. And when that happens, from what parts of the brain can be compromised or can potentially die just by what we call direct mechanical injury. So when blood escapes these arteries, it causes what we call a mass effect that compresses other parts of the brain. One thing to keep in mind is that our brain is surrounded by bone, which is our skull. So there's not much room over there. And if you have like a blood collection that suddenly happens, that can compress other parts of your brain and cause them to die. There's also an inflammatory response that usually happens after that can also cause problems. So these are the two types of strokes that we commonly see in the hospital.
Fascinating, doctor. So heads up, we've got a YouTube question. This one comes from Jasmine. Jasmine is asking, hey, Dr. Bounni, my dad's neighbor had a stroke, and his doctor said he's going to need a lot of time to recover. I'd like to know how quickly someone needs medical attention once symptoms begin and what can happen if they wait. Dr. Bounni, Jasmine asked another excellent question. Just how quickly should you react if you think someone is having a stroke?
That's an excellent question for sure. And the short answer to that is as quickly as possible. If you see someone who you think is having a stroke, the first thing that you should be doing is grabbing your phone and dialing 911. There's a saying that we neurologists really like, and it goes as time is brain. We have very effective therapies for stroke that we can do in the hospital, but these treatments, unfortunately, do not work well if you or your loved one show up late to the hospital. And as I said earlier, these brain cells, they're kind of fussy. They're accustomed to this constant flow of nutrients and oxygen that these, in the case of ischemic stroke, these arteries are providing to them. And if that gets interrupted, they start to die. And the earlier we get to the problem, generally the outcomes are better. And speaking of stroke therapies that we do, let's say you were to have a big clot that comes, let's say, from your heart and goes to your brain, to one of the big arteries of the brain. We have technology that allows us to go in and get that clot out and restore blood flow in the case of ischemic stroke. We also have very strong medications, specifically clot-busting medications. Probably heard of them, alteplase or tenecteplase, that dissolve clots that can also help someone who's having a stroke recover. And again, these therapies only work if you show up early to the hospital. If you show up the next day or even like hours late, sometimes the outcomes are not really good.
Well, speaking, you said time is brain or time is of the essence. This question is from our Facebook page. This one comes from Darcy, who is asking, Dr. Bounni, I'd like to know exactly what the acronym Be Fast stands for. I'm assuming it has something to do with symptoms. And it just so happens we had a viewer ask a question about that acronym Be Fast. So what does that stand for?
Again, excellent question. And what it stands for is balance loss, eyesight changes, face drooping, arm weakness, speech difficulty, and finally, time to call 911. And I'll walk you through each of these categories. So for balance loss, let's say your loved one all of a sudden they just couldn't walk. They were walking earlier. They walked into a restaurant. They're having dinner, and then they got up, and suddenly they just, for whatever reason, they couldn't walk. That could be a sign of stroke. So if something like this were to happen again, just call 911, bring them to the nearest emergency room, and they'll get evaluated. Obviously, there are different things that can cause a problem like this that are not strokes, and so that's why it's very important to be quickly evaluated by someone, an emergency room physician or a neurologist, to kind of tease those apart. The second symptom category, eyesight changes, things like losing part of your vision, or on the right side or on the left side, or suddenly losing vision with one eye or the other eye. Also, sudden double vision. These are things that could be concerning for stroke and need to be evaluated. F for face drooping, meaning your face, one side of the face is like droopy all of a sudden. That's something that's very concerning. Arm weakness or leg weakness, especially if it's sudden. Also, in rare cases, you could have weakness on both sides of the body that's sudden. That could also be strokes. Speech difficulty, either all of a sudden you cannot talk, even though you know what you want to say, but you can't say it, or you're talking and whatever you're saying is very slurred and difficult to understand. And finally, time to call 911. Again, kind of we keep emphasizing this point because it's very important. And in the case of hemorrhagic strokes, sudden severe headaches, can also be indicative of hemorrhage that's happening inside the head, especially if it's like the worst type of pain that someone could experience, and if it's like really sudden.
All right. Up next is another question from our allhealthtv.com page. And this one comes from Jen. Jen is asking, hi, Dr. Bounni. I'm studying to become a physician's assistant specializing in physical medicine and rehab. So how important is physical rehab when it comes to stroke recovery? Great question, Jen. Thank you so much. Physical recovery is so important to a full life. I mean, I would imagine, right, doctor?
Absolutely, and that's a great career path, very gratifying. And to answer your question, is of course it's very important. Oftentimes, we have patients that don't show up early enough to the hospital, or they're not lucky enough for our acute therapies to work very well for them. So they may have some what we call deficits, like let's say some arm weakness or some leg weakness or a little bit of a hard time walking or talking. And that's where physical medicine and rehab kicks in. It starts in the hospital, ideally within 24 hours if the patient is ready from hospitalization. The rehab team includes a physician that specializes in rehabilitation, physical therapists, occupational therapists, also in some cases, speech therapists. And the goal of rehabilitation is basically helping the brain relearn skills that were lost after the stroke. And what it entails is primarily repetitive exercises tailored to the patient's needs. Things we take for granted, like our ability to grasp a cup, reach for something with our hand, walking. We call gait training in medicine, just teaching you how to walk again or how to use your hand again. Things like that. It's usually tailored to the needs of the patient and to the problems that they're having after a stroke. So this is very important. And a lot of our patients also end up, after they leave the hospital, end up at a rehabilitation facility where they stay there for a few days to just have extensive rehabilitation and extensive exercises on a daily basis so they're able to tolerate it and just to get better quickly.
Great. It's great to hear that. So we've got another YouTube question. This one comes from Colton. Colton asks, hi, Dr. Bounni, what role do lifestyle factors, kind of going to that point when it comes to physical rehab, but going to lifestyle factors like diet, exercise, smoking, or stress play in stroke prevention? What a great question. Thank you so much, Colton. I would imagine, Dr. Bounni, this is extremely important.
Of course, it's extremely important, not just for stroke prevention, just to prevent cardiovascular diseases across the board and other health problems. So I would think of it as I would think of it globally and not just from a stroke lens. But speaking of stroke, regular exercise is very important. The American Heart Association actually recommends at least 150 minutes per week of what would they call moderate intensity physical activity, or 75 minutes of vigorous intensity activity for stroke prevention. And the way I phrase that in clinic is just try to get your heart rate up on a regular basis, whether that means walking or jogging if you can, or lifting weights, or whatever activity that you're playing tennis, whatever activity you like, as long as you're getting your body moving and your heart rate up. Depends on your age and on your abilities. So that's actually very important across the board.
When it comes to lots of things, right? Don't just
of course, absolutely. To look good and feel good too, as simple as that. And as you might expect, smoking is a major independent risk factor for stroke and all sorts of problems. And that doesn't stop at cigarettes, goes to cigars, smoking marijuana, and anything that, whenever you smoke anything, inhale that could potentially affect the quality of your vessels, both the large vessels and the small vessels, and that could cause problems in your brain and your heart, including stroke.
I have to
As
ask
far
you
as
this. What about vaping? Just because you brought up smoking.
I think there is data that is concerning when it comes to vaping. I'm not intimately familiar with any link to stroke specifically, but I generally recommend against vaping.
Gotcha. All right,
That's a
Doctor.
very good question.
Yeah, Doctor, this next Facebook question is from Arthur, and he wants to know, why do some stroke survivors have personality or mood changes afterwards? He writes, my neighbor Frank is one of the nicest guys that he knew, but post-stroke, he's been kind of checked out and always in a bad mood. Arthur, thanks so much for that question. I know other people have that question as well. So, Dr. Bounni, what is the deal with this? I mean, can stroke victims experience changes in personality?
The short answer is yes, and unfortunately, it's more common than you might expect. And mood changes and personality changes, and we don't always have an explanation for it. From my personal experience, it depends on the size of the stroke and the location of the stroke. Some parts of the brain we know are involved in regulating mood and behavior, and memory too, play a role in memory. And also, there are theories revolving around stroke causing a disruption in the release of what we call neurotransmitters. Like, you've probably heard of serotonin. It's like a chemical. It's all over the brain that plays a role in like mood and other things. And we theorize that having a stroke, especially if you've had a big stroke or multiple tiny strokes, can cause all sorts of cognitive and behavioral difficulties.
Well, that's really fascinating. So it can depend what kind and where it happened. Didn't know that. So, Dr. Bounni, we've got another question. This one is from YouTube, and it comes from Lawrence, who wants to know if women's stroke symptoms are different from men's. I gotta admit, Doc, I'm confused about this myself. Can you give us some clarification?
That's actually a very good question, and there's a large emphasis in the research community on studying both men and women and making sure that women is well represented in the data and the literature when it comes to stroke and cardiovascular diseases in general. So the symptoms are the same. They're the same symptoms that we talked about earlier. Things like you suddenly lose part of your vision, either with both eyes or with one eye. You have sudden double vision. You suddenly cannot talk okay. You suddenly cannot walk okay. You suddenly can't move your arm or your leg or both legs. Suddenly your face is droopy, or suddenly you're unresponsive, or suddenly you have a sudden explosive severe headache. So the symptoms are basically the same. And again, I'm sorry for repeating myself. It's just like very important to recognize these symptoms. That being said, there are some differences between men and women when it comes to stroke. For whatever reason, the same stroke size just tends to produce more symptoms in women. We also tend to see more young women have strokes than young men. And the same applies to older age. More old women have stroke than old men, probably because they tend to live a little bit longer. There are also some hormonal differences, as you might expect. There are also certain conditions that predispose to stroke. One of them is called atrial fibrillation. That's an abnormal heart rhythm condition that can make your heart prone to forming tiny clots that can go to your brain and cause strokes. We see that condition more commonly in old women than in men. So there are some differences, but as far as the stroke symptoms tend to be the same in men and women.
Yeah, and you're not being redundant. It's important information, and it's worth hearing again. So thank you, Doc. All right, this next question is from Callista, who reached out to us on allhealthtv.com. And you really should check out the website when you get a chance. It's just chock full of great information, trust us. So Callista's question is, hi, Dr. Bounni. I was told by the doctor on call that my sister had, and you touched on this earlier, doctor, a hemorrhagic stroke, which I found to be confusing because I thought there was only one type of stroke. Is that not the case? Again, great question. Doctor, I know you touched on this, but there is a difference. Can you describe what the difference is?
Of course. Yeah, that's a very good question. So there are, generally speaking, two types of strokes. Ischemic stroke, that's when one of the arteries, either a big artery or a small, or like tiny arteries in the brain, get clogged up. And that can cause an interruption in the flow of oxygen and nutrients to certain parts of the brain that start to die. And that's why we were emphasizing earlier on calling 911. If you think someone is having a stroke, coming early to the hospital so that we could potentially take that clot out or give a strong clot-busting medication that can restore a blood flow to these parts of the brain and help them recover. So that's the ischemic stroke. The second type of stroke is the hemorrhagic stroke, and that's when that's when the arteries in the brain burst. And what happens is they start having bleeding, essentially inside the brain, and that can compress essentially parts of the brain and cause them to start dying. And again, just like ischemic stroke, we want to take care of that as quickly as possible. Oftentimes we see the blood pressure is high, so we give very strong medications to the veins to lower the blood pressure. If someone is taking a blood thinner, we can give them other medications or agents to reverse the blood thinner that they were taking. Also, some blood collections can be surgically extracted nowadays with relatively minimally invasive surgery. So there are a lot of things that we can do to help as long as you present early to the hospital. And to recap, the two types of stroke are ischemic, when the arteries get clogged up, and hemorrhagic, when one of the arteries bleed inside the brain.
Thank you so much for distinguishing the difference, because I'm sure a lot of people watching thought just like she did, there was only one type. So this next question comes from Aubrey, who reached out to us via Instagram. Aubrey asks, hi, Dr. Bounni. My husband had a stroke a few months ago, and he's definitely on the mend, but can the brain really relearn skills that were seemingly lost after a stroke? And Aubrey, I think that's a really important question to ask. Thanks so much, too, for sharing your story, and I hope your husband gets well soon. But doctor, to answer her question, what do you have to say?
So the short answer is yes, but it depends on the size of the stroke primarily and the location of the stroke. But the short answer is in the next few months, we tend to see recovery with physical therapy.
We really do appreciate you joining us here for Ask the Doc, and for all of you watching, we appreciate your questions. We'll see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.